So continue for neuroanatomy for iVMRCS. This one is part 4. So last time we have seen up to the cranial nerves. Now let's go for the cranial venous sinuses. So if you go for this, see the sinuses. The sinuses are just for venous drainage. It's done in this manner. So this is called as falx cerebri. Sagittal sinus, sagittal falx cerebri in the partition in the center of the two cerebrum. So it has got the superiorly the drain through the superior sagittal sinus. That is called as superior sagittal sinus. This one superior is superior sagittal sinus. Then inferiorly you see inferior sagittal sinus. Then these two sinuses they connect to each other with the straight sinus. Then you get a transverse sinus. This is on the two sides. Then transverse sinus continue down as a sigmoid sinus, which continues down as the jugular vein. So there it is connected with the, here is the cavernous sinus connected with the sigmoid sinus. So if you see the sigmoid sinus has got very close proximity with this sigmoid sinus. This is the mastoid bone, and this is the impression of the sigmoid sinus on the mastoid bone. So any infection in the mastoid can be transferred to the sigmoid sinus. That's why this one is showing sigmoid sinus. You can see this is the cavernous sinus. Here you have seen this cavernous sinus is connected with the sigmoid sinus. Here you can see two sigmoid sinuses on the side, and this is connected with the cavernous sinus. So these are straight sinus. Superior petrosal sinus. This is sigmoid sinus, like this. So what's given in the sentences? The cranial sinus are located within the dura mater. They have no walls. This is one important point. There is no wall. They are important potential spreading sepsis. The superior sinus means when is hit on this from above, so it will be injuring to superior sinus. Inferior sinus is the inferior margin of falx cerebri. There is straight sinus and occipital sinuses. You can see this is straight sinus in the center. There is the straight sinus. Then occipital sinus, confluence of sinus, transverse sinus. You can see superior. These are the petrosal sinus, and transverse sinus are the occipital back side. There are transverse sinuses and all that. You can see this is sigmoid, this is occipital, this is transverse, this is straight. These are the on the back side. Now sigmoid sinus. So any infection, sigmoid sinus, mastoid bone infection may spread to middle ear downwards. So any infection will go middle ear downward may spread to sigmoid sinus. So here is again, this is the straight sinus in the center. These are transverse sinus, and this one is sphenoparietal sinuses. So these are, the green color is falx cerebri. What sinuses pass in the tentorium? Tent is just like a lateral tent, straight sinus between the tentorium and the falx cerebri, transverse sinus, superior and petrosal sinuses. Now you see a cavernous sinus. We have seen there are two cavernous sinuses like this on the, this is the scella turcica in the center, cavernous sinus here, cavernous sinus here. This is all cavernous sinus, two cavernous sinuses. What are the things that pass through the cavernous sinus? If you see, it is mnemonic is otom cat, OTOM. O is oculomotor nerve, third nerve, as it is passing from here to above, anteriorly, third, fourth, fifth, and maxillary also. They are passing the otom, olfact, oculomotor, trochlear, and optic. Then sixth nerve, cat is CAT. C is for internal carotid artery. A is the abducent nerve. And relations is medial to pituitary gland. Medial to it, to this there is pituitary gland. You can see this is hypophysis, and here is a sphenoid, and there is pituitary gland to this side medially, and laterally there is temporal cortex. This one is temporal cortex. Cavernous sinus thrombosis. Any thrombosis inside this is from the danger area of the face. Wall-less veins through the superior subthalamic vein to cavernous sinus. Clinical picture is painful swelling of the eye. So any painful swelling, third and fourth, fifth, sixth cranial palsy, and gradual loss of vision. Pterion is the junction of, this is again a question, it's junction of frontal, this one is frontal, parietal, this is parietal. There is no doubt about these two, frontal and parietal, you can see. And which is these two bones from the lower side? This one is temporal bone, this is sphenoid bone. Now among temporal there are two parts, squamous and petrous part. So this is the squamous flat part, and among sphenoid bone it is a greater wing, not the lesser wing. So greater wing of sphenoid bone, squamous part of temporal bone, petrous and squamous. So squamous part of temporal bone and the frontal part of frontal and parietal bone, they form the junction called as stereo. Relation is middle meningeal artery is passing very close to this. So how is the CSF flow? This is again a question. CSF flow is like this, in this manner. Lateral ventricles, the CSF is formed in the lateral ventricles through choroid plexus, and from this lateral ventricles there is a central foramen called as foramen of Monro. Again, just to remember, Mon is in the center, and from lateral to the third ventricle is passing to foramen of Monro or interventricular foramina. Then from third ventricle to fourth ventricle to cerebral aqueduct. From cerebral aqueduct, it is passing out into subarachnoid space by the central, that is again Maggie in the center and Lishka in the lateral. L is for lateral, Lishka, and M is for the middle. In the center, Magendy, Monroe, again in the center. Monroe, moon is above, so Mon is above. This is the above, first and to second or lateral ventricles. Magendy is down. So non-communicating is due to obstruction. Anywhere obstruction, that is dilatation of the previous ventricle and normal ventricle behind. So, and communicating is a defect in absorption in the arachnoid. This is again a question. What is the test for confirmation of CSF and beta 2 transferrin test? So these are the layers of the scalp. How to find out what are the different layers? It's from the SCALP. S is skin, C is connective tissue, A is aponeurosis, L is loose connective tissue, and P is periosteum. So loose connective tissue is in between the periosteum. This, so skull is always mobile on the bone. So skin rich with the sebaceous. So most of the time sebaceous is common in the scalp. Subcutaneous dense connective tissue from the lobi. Then aponeurotic layer, part of the occipital frontalis and ovals on the scalp. Loose connective tissue, mobile overlying tissue, and emissary veins which can then epinuclear aponeurosis. So this was about the neuroanatomy 4.